Drug withdrawal is a complex process that occurs when a person stops using a substance they have become dependent on. It's important to understand that withdrawal is not simply a mental challenge. It involves significant physiological changes, especially in the brain. This presentation aims to shed light on the different stages of withdrawal for various drugs, emphasizing the neurochemical effects and symptoms involved. When you use drugs regularly, your brain adapts to their presence. It starts expecting the drug's effects and adjusts its own chemical production accordingly. When the drug is abruptly withdrawn, the brain's delicate balance is disrupted. This disruption leads to a cascade of withdrawal symptoms, which can range from mild discomfort to life-threatening complications. The severity and duration of withdrawal symptoms vary depending on several factors. These include the type of drug used, the duration and intensity of use, individual health factors, and genetic predisposition. It's important to remember that everyone experiences withdrawal differently. Understanding the intricacies of drug withdrawal is crucial for several reasons. It helps to destigmatize addiction by highlighting its physiological components. It also underscores the importance of seeking professional help for safe and effective detoxification. Alcohol, a seemingly ubiquitous substance, carries with it a withdrawal process that can be surprisingly dangerous. Many people are unaware of the risks associated with suddenly stopping alcohol consumption, especially after prolonged use. Understanding the neurochemical underpinnings of alcohol withdrawal is essential for both patients and healthcare providers. This knowledge helps in anticipating the challenges and preparing effective treatment plans. When alcohol is consumed regularly, the brain adapts to its presence by suppressing the excitatory neurotransmitter glutamate and enhancing the inhibitory effects of GABA. This delicate balance is crucial for maintaining normal brain function. This adaptation leads to a dampening of the central nervous system, resulting in the familiar effects of alcohol relaxation, sedation, and impaired coordination. These effects are often sought after by those who consume alcohol regularly. However, when alcohol consumption ceases abruptly, the brain remains in this suppressed state. The sudden absence of alcohol can leave the brain struggling to regain its balance. The absence of alcohol allows glutamate to surge, while GABA levels remain low. The sudden shift creates a state of hyperexcitability in the brain. This neurochemical imbalance triggers a cascade of withdrawal symptoms, often beginning within hours of the last drink. These symptoms can escalate quickly if not managed properly. These symptoms can range from mild tremors and anxiety to more severe manifestations like seizures and delirium tremens, also known as DTs. The severity of symptoms often depends on the duration and quantity of alcohol consumption. DTs are a life-threatening condition characterized by confusion, hallucinations, and extreme agitation. Immediate medical intervention is often required to manage these severe symptoms. One crucial aspect of alcohol withdrawal is the depletion of essential B vitamins, particularly thiamine. These vitamins are vital for maintaining brain health and function. Thiamine plays a vital role in brain function, and its deficiency can lead to a serious neurological disorder called Wernicke-Korsakoff syndrome. This condition can have long-lasting effects if not treated promptly. This syndrome is characterized by confusion, memory problems, and difficulty with coordination. Early detection and treatment are crucial for preventing permanent damage. Therefore, medical supervision during alcohol withdrawal is crucial for managing symptoms and preventing complications. Proper care can make the difference between a safe recovery and a life-threatening situation. Opiate withdrawal, often characterized by intense physical and psychological discomfort highlights the powerful grip these drugs have on the brain. The journey through withdrawal is a testament to the profound changes opioids induce in the body's chemistry. When opioids like heroin or prescription painkillers are used regularly, they bind to opioid receptors in the brain, mimicking the effects of naturally occurring endorphins. This binding creates a sense of euphoria and pain relief, which can be highly addictive. Endorphins are the body's natural painkillers and mood elevators. They play a crucial role in our ability to feel pleasure and manage pain. Over time, the brain becomes accustomed to the presence of opioids and reduces its production of natural endorphins. This adaptation leads to a dependency on the external source of opioids to maintain normal function. When opioid use ceases, the brain is left in a state of endorphin deficiency, leading to a cascade of withdrawal symptoms. The body struggles to regain balance, causing significant distress. These symptoms typically emerge within 12 to 24 hours of the last dose and can persist for several days or even weeks. The duration and intensity of withdrawal can vary based on the individual's usage history and overall health. The hallmark of opiate withdrawal is a flu-like syndrome characterized by intense muscle aches, nausea, vomiting, diarrhea, sweating, and chills. These symptoms can be debilitating and make daily activities challenging. These physical symptoms are often accompanied by anxiety, insomnia, and intense drug cravings. The psychological impact can be just as severe as the physical discomfort. In severe cases, opiate withdrawal can lead to seizures and other life-threatening complications. Immediate medical attention is crucial in such scenarios to prevent fatal outcomes. Managing opiate withdrawal usually involves a combination of medication and supportive care. This holistic approach aims to address both the physical and psychological aspects of withdrawal. Medications like methadone and buprenorphine are often used to alleviate withdrawal symptoms by mimicking the effects of opioids without producing the euphoric high. These medications help to stabilize the patient and reduce the risk of relapse. This approach, known as opioid replacement therapy, helps to stabilize patients and reduce cravings, allowing them to engage in therapy and other aspects of recovery. Comprehensive treatment plans often include counseling, support groups, and lifestyle changes to support long-term sobriety. Stimulant drugs like cocaine and methamphetamine produce their effects by flooding the brain with dopamine, a neurotransmitter associated with pleasure and reward. This surge in dopamine is what gives users that intense feeling of euphoria and heightened energy. This surge in dopamine creates a sense of euphoria, increased energy, and alertness. People often feel invincible, more social, and incredibly focused, making these drugs particularly appealing in social settings or high-pressure environments. However, this artificial high comes at a price. The brain's natural balance is disrupted, leading to significant consequences once the drug's effects wear off. When stimulant use ceases, the brain experiences a sudden and dramatic drop in dopamine levels. This abrupt change can leave individuals feeling depleted and unable to experience pleasure from everyday activities. This dopamine depletion is the primary driver of stimulant withdrawal symptoms, often referred to as a crash. The brain struggles to regain its natural balance, leading to a host of uncomfortable symptoms. The crash typically begins within hours of the last dose and can last for several days or even weeks, depending on the severity of use. The duration and intensity of the crash can vary widely among individuals. The most common symptoms of stimulant withdrawal include fatigue, depression, anxiety, irritability, difficulty concentrating, and intense drug cravings. These symptoms can be overwhelming and make daily functioning very challenging. In some cases, individuals may experience vivid dreams or nightmares, insomnia, and increased appetite. These additional symptoms can further complicate the recovery process. While stimulant withdrawal is not typically life-threatening, the intense psychological discomfort and cravings can make it extremely challenging to quit without professional help. Support from healthcare providers and support groups can be crucial. Treatment for stimulant withdrawal typically focuses on managing symptoms and providing support. This can include therapy, counseling, and sometimes medication to help ease the process. There are currently no FDA-approved medications specifically for treating stimulant withdrawal. This lack of targeted medication makes managing withdrawal symptoms more challenging. However, medications like antidepressants or anti-anxiety drugs may be prescribed to address co-occurring mental health conditions or alleviate specific symptoms. These medications can provide some relief and support during the withdrawal process.